How lifestyle medicine fits into the paradigm for cardiovascular disease treatment and prevention. Nutritional aspects of care of cardiac patients, stress reduction, sleep, and attention to lifestyle, attention to the daily activities and routines that could actually make patients healthier and reduce the burden of chronic disease. Lifestyle medicine is giving a patient a set of tools and even guiding them through the process that would help them to implement your recommendations. So a patient who comes into my office, unlike perhaps a more typical visit, will actually walk out with a nutritional recommendation on paper and a food diary that I expect them to fill out and bring back. I think American College of Cardiology had made it very clear that part of our mission as cardiologists is to bring lifestyle medicine into the fold of our clinical practice and to make it available to our patients, perhaps engage other team members, whether cardiovascular nurses, physician assistants, registered dietitians, health coaches. I think as physicians we can truly pioneer development of the multi-level team model to bring lifestyle medicine into the cardiology practice and make it mainstream and make it standard of care. Education. So there is a lot of educational effort that takes place, and I think patients have become much more aware that prevention is a tremendous opportunity for them. They do know that eating right and eating healthfully and exercising is the key to wellness and the key to longevity. One of the issues, I think, is the fact that there's so much information and so much clutter and so much noise, and the patients get confused. Should they follow a paleo diet? Should they go low carb? Should they go low fat? Our most recent recommendations, cholesterol recommendation from the United States dietary guideline organizations have actually changed what traditionally have been the cardiology recommendation, right? So we were against cholesterol, now dietary cholesterol is fine. Saturated fat is a complicated topic, had not been found out necessarily linked to heart disease as strongly as we thought it was. So amidst that noise and clutter, patients do need guidance, and if you could give them the tools that are known and have been scientifically validated to derive a health impact, they appreciate it and they take it under advisement and they actually implement it. It's an issue for the entire family, because for the cardiac prevention to work, it has to be practiced on a family level. It's very difficult for a patient to eat a certain diet if their family members are not supportive. Women, for example, may do grocery shopping. They usually would buy these ingredients or things to have on hand to cook for the entire family. And we absolutely will get the biggest benefit of prevention if we start at an earlier age. So it's a family affair. The concept is really to promote personalized healthy eating, at least in my lifestyle endeavor. This is what I try. I try not to be the doctor dictator and tell them, you must do this, you must not do this, but I try to work with them to give them a range of options, tools that they can then personalize to make it work for them. And I find that there is a lot of back and forth. Patients do appreciate this interaction. I may approach it a little bit differently for an older patient who perhaps has limited resources and a fixed budget. I wouldn't necessarily tell them to go and buy mostly organic food. I'm mindful of the fact that their income may not allow them to do that. And there are definitely a lot of options, but the most valuable part of it is the commitment to wellness that starts and becomes a consistent effort. Eventually, if not in 6 weeks, then 6 months or maybe a year, these patients reach their weight loss goal, they do feel better, they have more energy, they use less medications. And even for patients who have experienced advanced stages of heart disease, this approach improves their wellness. We know that a lot of, for example, atrial fibrillation, congestive heart failure, a lot of these entities are driven by inflammation and dietary indiscretion. So to be able to give patients the tools that potentially could prevent them from sustaining exacerbations of these chronic conditions is valuable.